Hello and welcome to this podcast on drugs used in peptic ulcers. My name is Mohammad Farooq Jabir. In this podcast, we'll be primarily looking initially at the physiological process that is involved in producing gastric acid, as well as the formation of gastric ulcers. And look, with the help of this understanding of the physiology of gastric acid production, we'll be looking at drugs which target the physiological process of acid secretion, and also look at the different types of acid secretion prevention drugs. To start off, the term peptic ulcer refers to an area of ulceration in an area bathed by hydrochloric acid as well as pepsin, and peptic ulcers commonly occur in the stomach and upper part of the duodenum. Drugs used in the treatment of peptic ulcers either reduce gastric acid secretion or increase mucosal resistance to attack. To start off, we'll be looking at the physiological process involving gastric acid secretion by way of this image. I know it's a bit of a complicated image to be used, but I won't be discussing the entire image, just particular bits about it which are relevant. Parietal cells, which are the key functional unit in the lumen of the stomach, are involved in gastric acid secretion. Parietal cells achieve this by way of the hydrogen ion potassium ion ATPase pump that catalyzes the exchange of moving H+ ions out of the cell in exchange for moving potassium ions, which are present in the extracellular space, into the cell. Hydrochloric acid secretion is stimulated by acetylcholine released from the neurons of the vagus nerve, and also a secondary causative factor for stimulation of acetylcholine is gastrin, which releases the hydrochloric acid when amino acids are either present in the stomach or due to distension of the stomach due to consuming food. Both acetylcholine and gastrin stimulate acid secretion by releasing histamine from paracrine cells, and this histamine tends to act on parietal cells and activates the cell by way of binding onto H2 receptors. The mucus layers form the protective agent of the gastric mucosa is formed by a mucus layer, and this forms on the surface of the stomach and duodenum, and this mucus layer contains bicarbonate, which neutralizes gastric acid and hence protecting the wall of the stomach and duodenum. The gastric mucosa also produces prostaglandins, which also protect the mucosa by enhancing secretion of mucus as well as bicarbonate. Now that we have an understanding of the physiological process involving gastric acid secretion, we'll be looking at the drugs which target particular points in this physiological process. Starting off with H2 receptor antagonist, they block the action of histamine on parietal cells and reduced acid secretion. These drugs tend to relieve the pain of peptic ulcer and also increase the rate of ulcer healing. Proton pump inhibitors such as omeprazole and lansoprazole are inactive at neutral pH but need an acidic environment to be activated, and PPIs act on the hydrogen ion potassium ion ATPase pump and inhibit H+ ion transfer out of the parietal cell. Because the enzyme is irreversibly inhibited in the hydrogen ion potassium ion ATPase pump, acid secretion tends to only recommence after new enzyme has been synthesized for the hydrogen ion potassium ion ATPase pump. PPIs are particularly useful in patients suffering from gastric acid hypersecretion, as in the case of the Zollinger-Ellison syndrome, which is a very rare condition where there are gastrin secreting tumors. Coming on to mucosal protectants such as sucralfate, it forms a sticky gel at acidic pH and adheres to the base of the ulcer. Coming on to discuss about a key etiological factor involved in gastric acid secretion, that is the role that H. pylori plays. H. pylori is a spiral-shaped gram-negative rod found deep in the mucosal layer, where there is a pH of 7, which is an optimal environment for its growth. And in this second diagram, it shows the bacteria invading the epithelial cell surface and releasing toxins such as ammonia, which is formed by urease activity from the organism. This ammonia neutralizes the gastric acid to avoid elimination. The organism proliferates, forms an infective foci, which eventually leads to gastric ulceration by destruction of mucosa and inflammation, as shown in the fourth image. Uncomplicated cases of Helicobacter pylori infection can be treated by eradicating the bacteria by way of combination of a PPI and antibiotics such as clarithromycin and metronidazole. This is called triple therapy. Coming on finally to antacids such as sodium bicarbonate, magnesium hydroxide and aluminum hydroxide. These tend to raise the luminal pH of the stomach, and this increases the rate of emptying, and so the effect of antacids is short-lived. Gastrin release is increased, and because this stimulates acid release, large amounts of antacids are needed. That would be needed for ulcer healing. And that's about it for this podcast. We primarily looked at the physiological process involved in gastric acid secretion, as well as correlated the drugs to the physiological process of gastric acid secretion. Thank you and goodbye.